The Aging with Options show is about seniors and for seniors and their loved ones. Our passion is to provide interesting and informative content for seniors and their families living in the Louisville area. I'm Chris McCutcheon. Our topic today is reducing the incidence of falls among seniors. Gentiva Home Health has created a program to do just that. Safe Strides is the topic of our conversation today. My guests are Abele and Eric Wint, both with Gentiva. They've been sharing a lot of great information about the impact of their Safe Strides program, and it's had quite an impact on improving balance and reducing falls among seniors. So, Abele and Eric, tell us a little bit about Gentiva, the company that you work for, Gentiva Home Health. Tell us a little bit about that.
Sure. Gentiva, fabulous company. Gentiva is America's largest home health and hospice provider. We have offices, branches in 36 states. And here locally, we have offices, Louisville, Shelbyville, Lexington, Danville, Stanford, a lot of offices within the Kentucky area. In any certain year, we'll treat between 500 and 550,000 patients in a year's time. And, today, by the time this day is over, we will have seen around 12,000 patients today throughout all of our offices across the country. So
12,000 all in a day.
Every day.
You guys are hopping.
We're 24 hours, 7-day-a-week business, weekends, holidays. We are always open.
Eric, who's a candidate for home health?
Our candidates, obviously, we do focus on the senior population. In order to qualify for home health services, you have to be considered homebound, and that has had a lot of change over the last few years. So used to be if you went out on your porch and sneezed, you weren't considered homebound anymore per Medicare guidelines. Well, now that they've really loosened that, which is a great thing because it allows people to have better access to the services we provide. So like I said, you need to be homebound, but there are things you can go out to church, you can go out to get your hair done, doctor's visits. All those things do not disqualify you from home care regulation.
Who makes the determination whether somebody is homebound? Is that their physician, I guess, that does that?
It's a combination. It's between the physician. When they're looking to refer somebody to Gentiva, they will obviously look at that aspect. And then once we get out and do our initial evaluation, we'll make that determination. And if somebody is not homebound, we don't just kick them to the curb. We do make sure that through our clinicians, our office staff, social workers, if that's needed, that we get them to where they need to go to get their needs met.
An important concern, of course, to most consumers, certainly seniors, is the cost of health care.
Absolutely.
What can you tell folks listening about the cost of home health and how it compares to other options?
We are actually, as far as from a patient standpoint, we are a part of the Part A section of Medicare. So when a patient is referred to Gentiva, if they have Medicare, Medicare covers the entire cost of home health care. They will not have a nickel out of their pocket that they'll have to pay. No copay, no coinsurance. Their Medicare benefit takes care of the whole kit and caboodle. So that's a great thing. I know a lot of our senior populations have paid into that system for a long time, and it feels really good that they can get full advantage out of that because they've been putting into it for a long time.
We get to participate in it. So why would somebody choose home health versus an outpatient clinic, for instance? Well,
first and foremost, a lot of the folks that we see in home health, they have, say we're seeing them for Safe Strides, and that's the main reason we're going in, balance difficulty. Well, that doesn't mean that's the only thing that's going on with them. Usually they have other conditions that are comorbidities going on. So those folks it's tough for some of those folks to just be able to get out into their car, get out to the doctor's office, walk the length of the parking lot, and get to these outpatient services. So the benefit is we come right to your home, and we can treat in a person's home if that's where you live. If you live in an assisted living facility, we can come there. Anywhere that you consider it your home, we come right out to you.
Fantastic. And relative to the Safe Strides program, and kind of jumping back into that, for listeners that are interested in this program and are recognizing issues with fall risks and imbalance issues, is the initiation of the program, is that something that somebody can call your office and initiate, or does that have to be initiated by one of your practitioners that's in the field that's already in the home?
Absolutely. They can call our office, and we'll be giving that number out. You can call our office. You can talk with your physician. Let them know that you have some balance issue. You heard of the Safe Strides program. The doctors in town, they know who we are, and they'd be more than happy to refer you to our services. Now, in order for Medicare to pick up the tab, and to pay that benefit, then yes, they do have to be, you would have to be referred by your physician. But again, if you call our office, we can help you to get that process started if that's what you feel like you need. Gotcha.
Fantastic. And April, you touched on a little bit earlier about the assessment process. It's about 45 minutes initially, but then after that, it's ongoing. Is that right? I mean, it's something you continue to. It's not a one-time fix kind of thing, right?
Oh no, it's continual reassessments throughout the entire episode. We go out and we do what's needed for the patient. A large part of what we do for the rehabilitation, for the treatments, is education. Number one, we get in and we look at where they're living. If somebody has, a visual issue, then we will make sure, are there night lights? You're putting lights on at night. How does the lights look outside? We have that wonderful opportunity to be in somebody's home to not only work with them to get them stronger, all these systems of balance to get them stronger, but to look at their environment and see what their challenges are. Are there stairs without railings?
Right.
We need to help with that.
Lots of advantages to seeing their own environment where you're
absolutely.
Going into
If we see their deficits, then we know how to make them better. We might need occupational therapy to come in and help us with the bathing component of it.
Wow, very interesting program. Lots more to be said about it. Improving balance and reducing falls is the goal of Gentiva's Safe Strides program. It's also the topic of our show today. April Abele and Eric Wint are my guests today. We'll pause for these messages, and we'll be right back with April and Eric and more topics of interest to seniors in the Louisville area. You're listening to Aging with Options on 970 WGTK.